The following presentation has been produced by Electrolysis Research Corporation, located in Fond du Lac, Wisconsin. Electrolysis Research Corporation is dedicated to the advancement of electrolysis as a profession through basic research and the production of educational materials. This topic will be discussed by Dr. James Shuster, a well-known lecturer in the field of electrolysis. Dr. Schuster's credentials include training in electrical engineering and medicine at the University of Wisconsin and dermatology at the University of Michigan. Dr. Schuster is a board-certified dermatologist and licensed electrologist practicing in the state of Wisconsin. We are indeed pleased to present this unique educational opportunity.
Our topic is galvanic electrolysis, a modality that has withstood the test of time and today is widely used for both straight galvanic and blend epilation. In our order of presentation, we will first look at the history of electrolysis, going back to 1869 when Charles Michel began his first experiments with electrolysis for permanent hair removal. We will then look at the basic concepts of direct current and how it produces the electrolytic effect. After basic concepts, we will analyze the variables that are important to the electrologist and consider their effect on the pattern of lye production. A dramatic part of this presentation will be observing the actual destruction of fresh human hair follicles by electrolysis using microscopic video techniques. We will then discuss several important considerations like current paths in the body, and finally we will conclude with a statement of the overall relevance of galvanic electrolysis and its future for permanent hair removal. As most electrologists well know, the field of electrolysis is full of ambiguous terms. We agree that the term electrolysis should remain as the generic term for the profession in general. We are electrologists. We practice electrolysis. The term electrolysis, however, is also loosely used to indicate both galvanic and shortwave forms of permanent hair removal. In an attempt to prevent confusion, we refer to the different modalities as galvanic electrolysis, thermolysis, and blend electrolysis. Other terms that you might encounter for galvanic electrolysis include just plain electrolysis, galvanic, direct current electrolysis, and in this lecture we will use galvanic electrolysis. The history of electrolysis began with the research of Dr. Charles Michel, an ophthalmologist from St. Louis, Missouri. Dr. Michel was perplexed by the problem of ingrowing eyelashes. These bristly hairs could rub on the cornea of the eye, sometimes leading to blindness. Plucking these erupting eyelashes was not easily accomplished by the afflicted person, and other methods of the time were either too destructive or ineffective. To find a safe, effective method for treating this common cause of blindness, Dr. Michel began research in 1869. His first apparatus used a simple battery and a small wire filament, which he inserted into the eyelash follicle. The results were astounding. No more hair, plus the method was safe and permanent. Dr. Michel first published his findings in 1875 in the St. Louis Clinical Record. Additional research followed quickly, and the method was readily accepted by the medical community. It was also not surprising that the technique was soon used for treatment of hypotrichosis, and after a number of years, trained technicians called electrologists began using the technique. As time went by, the slowness of single-needle electrolysis became apparent. In 1916, Professor Paul Cree devised an electrolysis machine that used more than one needle. The method was subsequently called multiple needle electrolysis and has been used successfully up to the present time with only minor modifications to provide more ease of use. Other pioneers in the development of electrolysis were Henry St. Pierre and Arthur Hinkle, who were responsible for combining galvanic and short wave currents to produce what has been called the blend technique. This modality caught on slowly, but currently enjoys great popularity throughout the United States and abroad. The theory upon which galvanic electrolysis is based on is that the effect of direct current on a salt solution. It has been known for a long time that the flow of direct current through a solution of salt water produces a unique reaction. The electrical current causes the salt and water to break down into their constituent chemicals, which then rearrange themselves to form entirely different chemical substances. This process of direct electrical current working on a salt solution is called electrolysis. In this diagram, we show exactly what happens during the electrolysis of saline. For those of you wondering what saline is, a simple definition is salt water. If you take a tablespoon of table salt and dissolve it in a quart of water, you have saline. During electrolysis, whether in the human body or in the laboratory, the same chemical reactions occur. Sodium chloride, which is table salt, and water change to sodium hydroxide, which is lye, and hydrogen gas at the negative electrode, and hydrochloric acid and chlorine gas at the positive electrode. Of course, if you want this reaction to occur, you need a constant flow of direct current passing through the salt solution from negative to positive. Here we have a simple drawing illustrating electrolysis. First of all, we have direct current flowing in a complete circuit from the current source, which can be a simple battery, to the negative electrode, then through the salt solution to the positive electrode, and then back to the current source. If we look at the negative electrode, we see tiny bubbles forming around it, which are hydrogen gas. These rise to the surface. In the solution around the negative electrode, sodium hydroxide or lye is formed. It's the caustic nature of lye that destroys tissue when this reaction occurs in the human body. At the positive electrode, we also see tiny bubbles forming, which represent chlorine gas and possibly some oxygen gas. In the solution surrounding the positive electrode, hydrochloric acid is formed. It is this combination of chlorine gas and hydrochloric acid that can irritate the skin, causing indifferent electrode rash. A special concept that all electrologists should understand results from the application of Faraday's law. Simply put, this law states that the amount of lye produced in a follicle is directly proportional to the amount of current flowing in milliamps and the time in seconds that the current flows. An example shows that the same amount of lye is produced with different variations of current and timing. The exact same amount of lye is produced if you adjust your machine to 1 milliamp and depress the pedal for 5 seconds, or set it for a 1/10 milliamp and depress it for 50 seconds, or set it for 5 milliamperes and depress it for 1 second. Faraday's law is what the familiar units of lye is based on. Arthur Hinkle was the first to use this term, and it remains as the basis for epilator settings depending on the type of hair being treated. 1 unit of lye is defined as the amount of lye produced when direct current of 1/10 milliamp flows for 1 second. Following from this basic equation, 5 units of lye will be produced if 5/10 of a milliampere flows for 1 second, or if 1/10 milliampere flows for 5 seconds. Faraday's law on units of lye is probably the most important concept in understanding galvanic and blend electrolysis. Let's consider the basic circuit of a galvanic epilator. This diagram shows the simple components that are necessary. The most important component is a source of direct current. Early galvanic epilators used batteries. A common 6-volt battery works just fine. Modern galvanic epilators take household alternating current and change it to direct current using a rectifier. The direct electric current then flows from the negative pole of our DC source through a milliammeter to the electrolysis probe. The milliammeter is necessary to tell us how much current is flowing in the circuit and, considering time, how much Li is being produced. From the probe, the electric current flows through the tissues of the body to the indifferent electrode, which is usually held in one hand. From the handheld electrode, the current flows back to the positive pole of the DC source. In order to turn the current on and off, a switch is placed in the circuit. A rheostat or variable resistor is also used to vary the intensity of the current. As you can see, the galvanic epilator circuit is quite simple. Some electrologists wonder why the indifferent electrode is necessary with galvanic and not with thermolysis. The reason is high-frequency current can flow through the air by capacitive return. Direct current doesn't have this capability, so a wire is necessary to complete the circuit. Let's briefly look at our circuit. We see our DC source with a negative pole and a positive pole. The current travels in this direction through the milliammeter, which tells us how many milliamps of current are flowing in the circuit, and then to the probe. The current flows from the probe through the human body to wherever the indifferent electrode is being placed, which is usually a hand, through the variable resistor, which can change the amount of current flowing in the circuit, through the switch, which can turn it on and off, back to the positive side of our DC source. Let's examine the effect of Li on live tissue. Li, or sodium hydroxide, is a strongly alkaline and caustic chemical. No wonder that Li is the active ingredient of household cleansers such as Drano. If this chemical can eat away the sludge in your drain pipes, you can imagine what it can do to sensitive live human tissue. Fortunately, in electrolysis, the Li can be produced in small, measured amounts in follicular tissue, causing selective destruction of follicular parts without significant destruction of adjacent skin and subcutaneous tissue. The exact effect of Li on human tissue is to break up the complex tissue proteins that are vital for life. In breaking up these complex chemicals, which are normally like jelly in consistency, the tissue becomes liquefied, producing a soupy liquid composed of tissue fluids and denatured or decomposed proteins. This liquid, although not poisonous, is not compatible with life. Normally, after electrolysis, the body absorbs these non-living chemicals and recycles them, producing new live tissue where the follicle once was. The Li itself is neutralized by chemicals in the body called buffers. The body normally has no trouble dealing with the small amount of Li produced. To more fully understand how Li is produced in the human hair follicle, we need to look at the Li gradient concept. We chose a standard cylindrical non-insulated probe, and we insert it into a salt solution similar to human tissue. We then pass direct current from the negative pole of our epilator through the probe into the solution. The result is the production of Li in the solution around the probe. The concentration of Li and also the greatest destructive potential will be in the solution closest to the probe. As you go farther and farther away from the probe, the concentration of Li becomes weaker and weaker until you get to a certain distance away where the Li is so weak that it has no damaging effect on the tissue. This is called the critical zone. A definition of this critical zone is as follows. The critical zone is the distance from a probe beyond which the Li is not strong enough to do any damage. Simple example would be to put a teaspoon of lye crystals in 20 gallons of water. The resulting solution would be so weak it wouldn't even burn your eye if some splashed into it. If, however, you took 1 teaspoon of lye and put it into a cup of water, you would have a very strong caustic mixture that would quickly damage the tissue of your eye or a hair follicle. Of course, if you are trying to destroy the bulb and dermal papilla of a hair follicle, you must be sure that all of these structures are within the critical zone and not outside it. If part of the dermal papilla lies outside the critical zone, this part will survive and the hair will regrow. In this diagram, the red area has a lye concentration strong enough to destroy follicular tissue. In order to understand the behavior of galvanic current, it is important to understand current density. A fairly simple definition of current density is the amount of current, specifically the number of electrons, flowing out from a given surface area of a probe. Remember that according to Faraday's law, the amount of lye produced depends on the number of electrons flowing through the tissue. Therefore, if there is a greater density of electrons flowing through tissue, more lye will be produced. To illustrate current density, let's look at this drawing of 3 wires. We make the wires square so that their cross-sectional area can be more easily seen and compared. The first wire on the left has the same cross-sectional areas as 4 of the smaller wires on the right. In other words, you could put 4 of the smaller wires into the large wire. The small red dots are electrons. If you look at the middle wire, there are 5 electrons flowing at a given point in the wire, or 5 electrons per 1 square inch. The wire on the right has 20 electrons per 1 square inch. Therefore, the wire on the right has 4 times the current density as the middle wire. The wire on the left has 20 electrons per 4 square inches, which is the same as 5 electrons per 1 square inch. So, the left and middle wires have the same current density, despite the fact that they are different sized wires. To explain current density more practically, where there is 4 times the current density, there will be 4 times as much lye produced. Try to understand current density. This is one of the most important concepts in electrolysis and pertains not only to galvanic electrolysis, but also to thermolysis and blend. With the concept of current density clear in our minds, let's consider the different variables and how they affect galvanic electrolysis. In order to properly evaluate and visualize exactly how a variable such as intensity affects the pattern of lye production, an analog model was devised. We use analog models to analyze variables in electrolysis when there is no other practical way to see or evaluate exactly what is happening inside the hair follicle. Of course, we realize that the analog model is not exactly the same as a hair follicle, but despite this fact, it gives very valuable information regarding basic patterns of lye production. The specific analog system we will be using was devised by Electrolysis Research Corporation almost 20 years ago. It consists of a special indicator medium that turns from a white translucent color to a bright violet color in the presence of sodium hydroxide or lye. Here it is easy to see the pattern of lye production around standard cylindrical probes. Note that the same pattern of lye is produced at all levels of the probe, unlike thermolysis where the heat is produced mainly at the tip. Here we show the galvanic analog model at work. Remember, the media into which the probe is inserted will turn a bright reddish purple where lye is formed. You can now see the lye being produced. See how the pattern becomes wider and wider. Look along the probe and you will see the tiny bubbles of hydrogen gas being formed. You'll also note that the lye pattern is the same at all levels for this standard cylindrical probe. We are using approximately 1/2 milliampere for this demonstration. The analog model is mostly salt water, just like human tissue. The specific variables we will examine are these. We will examine timing, intensity, depth of probe insertion, probe diameter, pulsing or tapping, which is not used very often with galvanic electrolysis, and type of probe. The first variable we'll examine is timing. Basically, timing is the length of time the current flows from the probe to the follicle tissue. There are two types of timing, automatic and manual. Most of the more modern galvanic and blend machines provide both types of timing. The multiple needle galvanic machines usually have only automatic timing, as it would be impractical to manually time 16 different probes. Let's examine timing with respect to current density. If we change only the time or duration the current flows and not the intensity, the current density is the same whether we let the current flow for 30 seconds or 5 minutes. What does change is the number of electrons that flow from the probe into the follicle tissue. If the current flows 1 second, a certain number of electrons will flow. If we let the current flow for 2 seconds, twice as many electrons will flow into the tissue. Remember that the amount of lye produced depends on the number of electrons. So the 2-second probe will produce twice as much lye around it as the 1-second probe. This experiment is similar to the one shown previously, but in this showing we will examine the pattern of lye production with only timing being variable. Intensity is about 1/2 milliamp and depth of insertion is constant. Note that as the timing gets longer and longer, the pattern gets wider and wider, but keeps its basic cylindrical shape. We are using a standard cylindrical probe, which is the most common probe used for galvanic and blend. Also note that the lye is actually being produced in the media and not only along the probe. This is contrary to some writers who state that the lye is made around the probe and then soaks into the tissue. This photo shows a comparison of 4 probes with different timing. Let's look at only the 2 center patterns. The probe on the left shows 10 seconds of timing, the one on the right 50 seconds of timing. Approximately 5 times as much lye will be produced around the right-hand probe. The point to remember with timing is that the amount of lye produced is directly related to the time duration of current flow. The next variable we'll examine is intensity. Intensity can be defined as the strength of the electric current as it flows from the probe to the follicle tissue. Let's now examine intensity with respect to current density. Remember, when we examine one variable, that's the only one we vary. All the rest are left unchanged or constant. Here we see 2 probes, one with 1 milliampere of current, the other with 3 milliamperes of current. You can see there are 3 times the electrons coming out of the small box on the 3 milliampere probe compared to the 1 milliampere probe. Therefore, 3 times as much lye will be produced in the same amount of time. To put this in more practical terms, if you turn up the intensity of the galvanic current from 0.1 milliampere to 0.2 milliamperes, the lye will be made twice as fast. Here we see the effect of intensity displayed by the galvanic analog model. Each probe has 1/10 milliampere greater current flowing through it from left to right. You can see as the current intensity increases, the width of the lie pattern gets wider, indicating more lie is being produced. If you look closely, you will also note that the bubbles around the probe are getting larger, indicating more hydrogen gas is being produced as the intensity is being increased. If you look close here, you can see that the width of this lie pattern is much narrower here than it is on the right over here. Also, you can see these bubbles around the probe. Right around the center here is a bubble, and you can see the bubble is getting bigger and fatter as the amount of intensity gets greater. The third variable we'll study is depth of probe insertion. Depth of insertion can be defined as how deep the probe is inserted into the follicle. When we studied thermolysis, we noted that the probe gets hotter when depth of insertion becomes more shallow. We'll now see what happens with galvanic. Let's examine depth of insertion with regard to current density. Each of the two probes you see have 1 milliampere of current flowing from them. The only difference between the probes is that the left probe is twice as deeply inserted as the right. Now the same number of electrons is flowing into each probe, and the same number of electrons has to flow into the tissue from each. The difference is that there is twice the area on the deep probe from which the current can flow into the tissue. Because the shallow probe can't conduct its current into the air, all of its electrons have to flow from 1/2 of its probe length, causing twice as many electrons to exit the probe from the inserted portion. Therefore, twice as much lie will be produced in the tissue around the shallow probe compared to the deep probe. More simply put, all other variables being equal, a shallow galvanic probe is much more caustic than a more deeply inserted probe. Here we can see exactly what happens using the galvanic analog. Again, all variables are the same except depth of insertion. You can easily see that as you pull the probe to shallower and shallower depths, the width of the lie pattern gets wider and wider. The total amount of lie made is the same for each probe because timing and intensity are the same. But for the shallow probe, all that lie has to be made in a very short space. Another variable we'll examine is probe diameter. Probe thickness is another term often used. Examining probe diameter with regard to current density, we see that the same number of electrons have to leave the probe from a smaller area on the thin probe, making the current density greater next to the thin probe. However, because timing, intensity, and depth of insertion are all the same amount of lie will be produced around each probe. At 1 millimeter or 2 millimeters out into the tissue from each probe, the lie concentration will be roughly the same. Therefore, for all practical purposes, the probe thickness is not important from an electrical point of view. Use any diameter probe you want to make your best insertion. This statement, of course, is not true for thermolysis. Examining probe diameter using the analog model, we see the same diameter of lie pattern around a number 2 probe and a number 6.5 probe. Remember, timing, intensity, and depth of insertion are the same. Another variable that is sometimes used in the blend technique, and rarely with straight galvanic, is pulsing or tapping. A proper definition of pulsing would be delivering 2 or more pulses of current during the treatment of a single follicle. This graph illustrates pulsing. It shows how 2 seconds of current can be given 3 ways. It can be given in a single 2-second pulse, as in B, 2 1-second pulses, as in C, or 4 half-second pulses, as in A. Because Faraday's law tells us that the amount of lye produced is related to timing times intensity, the same amount of lye will be produced from each form of pulsing because the intensity is the same for each and the total time for each is 2 seconds. Therefore, for all practical purposes, the total time the current flows is the important point, not the number of pulses. This is not true for thermolysis. Remember that multiple pulsing slows you down because of the time between pulses when the current is not flowing. The statement that pulsing makes no difference with galvanic as long as the total follicle treatment times are the same can be proven with the analog model. The 2 probes on the left are number 2s. The 2 on the right are number 6.5s. The left probe of each set had a single 60-second pulse, and the probe on the right of each set had 3 20-second pulses, separated by 10 seconds. You can see that the width of lye production is approximately the same, showing that with galvanic, probe diameter and pulsing have little to do with the pattern of lye production. As we mentioned previously, that is not true with thermolysis. Now these pictures here are not easy to see because they're a little dark, but take my word that the diameter of the lye produced for each one of these probes in both sets is essentially identical. The use of different probe types with galvanic is not quite as complicated as with thermolysis, but the serious electrologist using straight galvanic or blend should be aware of the advantages and disadvantages of each type. First, we will study the use of 3 non-insulated probes, namely the standard cylindrical, bulbous, and tapered. Then we will examine the use of insulated probes. In this view, we have the 3 basic types of non-insulated probes, the standard cylindrical on the left, then the tapered in the middle, and the bulbous on the right. We will now examine each type using the analog model. In this photo, we see the lye pattern around the standard cylindrical probe. As you can see, lye is produced in equal amounts along the entire inserted length of the probe. Here we see the lye pattern around the tapered probe. As you can see, there is more lye produced higher up on the probe where the probe diameter is thickest. Because of this fact, tapered probes are not recommended for use with straight galvanic. With blend, it's a different story. The tapered probe has a positive advantage with thermolysis, so the negative effect with galvanic balances out the positive with thermolysis. Therefore, tapered probes are acceptable with blend. My personal feeling is that if you are using blend with lots of galvanic, I would avoid using the tapered probe. Here we see the bulbous probe tested in the galvanic analog. Thinking back to the tapered probe, you might expect a wider lye pattern at the tip. But if you look closely, the pattern is about the same as the standard cylindrical probe. Apparently, the slight widening at the tip does not significantly affect the overall lye pattern. Therefore, I see no advantage or disadvantage to using bulbous probes with galvanic or blend, at least from an electrical point of view. Let's examine the use of insulated probes. Not many electrologists use insulated probes with blend and even less with straight galvanic. One of the problems has been the question, will the insulation hold up to contact with lye? Insulated probe manufacturers have been reluctant to give advice in this regard, so the electrologist has also been reluctant to use them. Hopefully some advice will be forthcoming. In the meantime, it seems that most insulated probes can be used with galvanic, but the insulation may not hold up quite as long. This is a typical insulated probe. You can see the shiny metallic tip and also where the insulation begins. You can see the metallic exposed non-insulated part of this probe going up to about this point. From this point on, we have the insulated portion of the probe. Here we examine the insulated probe with regard to current density. As you can see, we have two probes inserted into the same depth, each having 1 milliampere flowing from them into the tissue. Only with the insulated probe, all the electrons must flow into the tissue from one small area on the probe, namely the tip. Therefore, the current density at the tip of the insulated probe is 3 to 4 times greater than along the entire length of the non-insulated probe. There is certainly no electrical reason that insulated probes can't be used with straight galvanic or blend. Here we see all 4 probes and their respective lie patterns. Only look at the shape of the lie pattern because the other variables were not held constant. The first probe is the standard cylindrical and the second the bulbous. Their pattern shapes are roughly the same. The third probe is the tapered, showing a wider pattern at the top where you don't want it. The fourth probe is the insulated probe, showing lie only at the non-insulated tip. The following microscopic video experiments are unique and to our knowledge have never been performed previously. You will actually see probes enter fresh human hair follicles and watch them course through the follicle tissue down to the bulb area. You will also see the action of galvanic current and watch the bulb area of a follicle disintegrate and liquefy right in front of your eyes. We'll now observe some of these fascinating experiments. Here we show an insulated probe produced by the Laurier Company. Note the shiny metal tip and the black insulation on the upper insulated shaft. The insulation on all insulated probes we've tested is quite effective for low voltage direct current as used for galvanic electrolysis. As the current begins to flow, you will see the lie being produced only around the non-insulated part of the probe. As time passes, the pattern of lie gets larger and larger. Remember, our analog model is very sensitive to lie production. In actual practice, the critical zone of lie production would not be as wide. The analog model is mainly for examining variables and seeing where the lie is being produced and its specific pattern. Before actually treating a follicle with galvanic current, we will demonstrate the probing of fresh human hair follicles removed during scalp surgery. You can see how easily the standard cylindrical probe passes through the external root sheath down to the bulb region. Under greater magnification, you can see the probe pass by the bulb region and see a slight resistance as the probe pushes against the end of the follicle. And then actually break through the end of the follicle. In some patrons, electrologists can feel the end of the follicle, especially if the probe is not too sharp. Here is another example of a fresh human hair follicle being probed prior to being treated with galvanic current. Again, notice how easily the probe glides through the external root sheath and the resistance at the end of the follicle. This also demonstrates the jelly-like consistency of the external root sheath cells and why this is the path of least resistance when probing the follicle from the level of the sebaceous gland entrance to the bulb area. Here you will see galvanic current destroying a follicle right in front of your eyes. We're using an insulated probe. You can see the bubbling from the hydrogen gas, and if you watch the bulb area, you will see it slowly disintegrate. Watch the pigment of the bulb area, and you'll see it kind of beginning to come apart and form kind of eddies or little flows of tissue that has been liquefied by the lye production. You can also see how the hydrogen gas bubbles tend to stir the tissue around that's being liquefied. If you look at the end of the follicle, there's a break in the end, and you can start seeing the bulb pigment leak out. And if you watch this pigment, you'll see it kind of curve above and below the follicle, showing that there is true disintegration of the bulb area due to the lye. If you also look just above the bulb area, you can begin seeing the distal part of the hair shaft also kind of disintegrating and losing its rigidity. Now you can see quite a bit of pigment coming out of the end of the follicle, particularly underneath the bulb area. Here's another example of galvanic action at work. We are using an insulated probe to confine the action at the tip so that destruction of the follicle occurs sooner. We are using approximately 4 milliamperes. Again, you can see the hydrogen gas beginning to form around the tip. If you watch the bulb area, you will begin to see it disintegrate and the pigment forming what I call a follicular soup. It's kind of a dark soup, so you can see the actual pigment of the bulb area disintegrating and flowing backwards in the follicle cavity. If you look closely, you will see that the entire bulb area is pretty much disintegrated and destroyed. In this last video insert, we get to see what frothing is all about. If you look where the probe is entering the follicle, you can see a little cluster of bubbles. You can even see bubbles coming up the follicle and pushing towards the top. These are the little bubbles caused by the hydrogen gas, and of course they begin down in the lower part of the follicle and work their way up. Several important considerations will be addressed at this time. These include positive surface galvanism, which is usually referred to as cataphoresis, and we will also discuss current pathways in the human body, tattooing, and shocking. Positive surface galvanism, more commonly referred to as cataphoresis, is the use of the positive pole, usually in the form of a carbon roller, to distribute galvanic current to the surface of the skin. The term cataphoresis derives from the fact that galvanic action drives positively charged particles to the negatively charged cathode. In medicine, this term is used when a particular drug or substance is driven into the skin by galvanic current. In this diagram, you see a positively charged plate overlying a lotion with a positively charged drug in it. A negative plate is placed under the skin. When the current is turned on, the positively charged drug particles flow into the skin from positive to negative. Think of the positive pole repelling the positively charged drug and the negative pole attracting it. Here you can see your negative plate. This would be the same as the negative charge on the body because you're holding the negatively charged handheld apparatus in this particular experiment. Normally you hold the positive when you're doing electrolysis. In this case, a plate is placed on the skin with a coating of a drug or some type of chemical substance with a positive charge in it placed on the skin. This is the skin right here. Because of the positive charge on the plate overlying this chemical, the positive charge here will repel the positively charged drug, driving it into the skin. The negative charge in the body or the skin will tend to attract this positively charged drug. And this basically is called electrophoresis, or in this particular case where you're driving the drug to the cathode or negative electrode, we call it cataphoresis. In electrolysis, the term cataphoresis usually refers to a form of after-treatment used with galvanic electrolysis or blend. It has no beneficial effect after thermolysis. Cataphoresis is usually accomplished by winding a piece of 2x2 gauze saturated with a conducting solution like witch hazel or saline around a carbon roller attached to the positive terminal of the epilator. The patron holds the negative pole in her hand to complete the circuit. The useful effects of cataphoresis are twofold when applied after performing galvanic or blend electrolysis. It tends to provide a soothing effect, and it tends to reduce redness or erythema. The means by which these two effects are produced is mainly by vasoconstriction. The positive current causes the tiny blood vessels in the skin to constrict or become smaller, thereby allowing less blood to circulate in the treated skin. When there is less blood, there is less redness, less heat, and less swelling or edema, all beneficial effects for after-treatment care. The next important consideration we will discuss is current pathways in the human body. Actually, the human body behaves no differently than any other electrical conductor. In particular, electric current will always take the shortest conducting route between 2 points. With galvanic or direct current, tracing the conducting path is very easy. First, consider the area you are working on. We'll say the right upper lip. Second, consider where the indifferent electrode is attached. We'll say the left hand. The path of the current, then, is the shortest path between these 2 points. The current will flow from the right upper lip around both sides of the mouth, heading for the left neck down to the left shoulder and out the left arm to the left hand. There are several reasons we mention this phenomenon. These are metallic taste, metallic objects in the body, and pregnancy. To minimize metallic taste while working on the right upper lip, hold the indifferent electrode in the right hand. This way, less current will flow around and through the mouth, but rather go down the right cheek and neck to the right hand. When working on a pregnant female, choose your current path so that it doesn't cross the pelvis, and don't work on the belly or breasts of any woman during the 3rd trimester. With regard to metallic objects in the body, we need to consider where they are usually found. Here we see locations of a metallic hip and shoulder. This would be the location of the metallic hip, and up here we see a metallic shoulder. And on the right, we see metallic fillings in the teeth, metallic wire or staples from a chest or heart operation, a metallic IUD, and a metallic plate to fix a broken leg. Here we see a plate in the leg. Here we see the location where you would find a metallic IUD. Up here are where the Staples, wires, or clips following chest operations are usually put, and of course fillings can be found any place in the mouth. To address the question of metallic objects in the body, we conducted an experiment whereby a paperclip was suspended in our galvanic analog model. We passed 1 milliampere of current through it for about 1.5 hours and looked for purple, indicating lye production. As you can see, a small amount of lye was produced at each end of the clip. To prevent this from happening in your patron, choose the current path so it bypasses the metallic object. Now, I would be the first to admit that this is a theoretical consideration since I'm not aware of any problems caused by not following this advice. But it is possible that problems were overlooked or that I haven't heard of a specific problem. I still believe it is good advice nonetheless. Tattooing is currently not a common complication with modern epilators. Most modern machines don't allow you to connect the probe to the positive terminal because of a special connector on the needle cord. Tattooing occurs when the probe is mistakenly connected to the positive terminal of the machine. Hydrochloric acid, which is produced along the positive probe, eats or etches away the metal probe, depositing the metal in the cells of the follicle and skin. This dark gray-black color will persist indefinitely as a tattoo and pose a serious cosmetic problem for your patron and possibly a lawsuit for you. Therefore, don't ever connect the positive pole to the probe. The last important consideration is shocking. There are 3 types to discuss. General shocking is the tingling, burning sensation when a significant amount of current is flowing into a follicle. Most patrons would describe it as painful, particularly when the current gets into the 1/2 to 1 milliampere range. The second type of shocking, called mass effect shocking, is the same as the first, general shocking, only occurs primarily with multiple needle galvanic electrolysis. Despite lower currents flowing in each multiple needle probe, say 1/10 of a milliampere, if 10 probes are firing, there will be 1 milliampere of current flowing from the part of the body where you are performing electrolysis. Although not as intense as 1 milliampere from one probe, the total shock perceived will be greater than the 10th milliampere from one probe. This type of shock phenomena is called mass effect shocking. The third type is make-break shocking. When you abruptly turn galvanic current on or off, there is usually an exaggerated jolting type of shock. This is called make-break shocking. To eliminate this type of shock, modern epilators allow the current to build up and shut off slowly in what is termed ramping. This drawing shows a galvanic pulse envelope. You will see the slope at the beginning and the end of the pulse. This photo shows galvanic pulse photographed on an oscilloscope, and it shows you exactly how ramping looks. You can see that the current doesn't abruptly build up and stop, but rather there is a slope to the line. Here we can see this is showing primarily voltage, and you can see that instead of when the current is turned on here, the voltage doesn't immediately go up to the working voltage here, but it kind of goes up slowly here. And of course, when it goes off, it doesn't just come straight down to zero. It kind of slowly goes down to zero along this particular curve. As you have just seen, galvanic electrolysis has had a long history. As we observe our world, we see many concepts and technologies being replaced as newer and better ones come on the scene. Because of this, we might wonder why 120-year-old galvanic electrolysis is still around. Well, it's around for good reason. It works and it's safe. Although it's possible that a better method may be found in the future, we currently have two excellent modalities in galvanic electrolysis and thermolysis, of course, blend included. This concludes our video presentation on galvanic electrolysis. I hope you have found it as exciting as we have to actually witness galvanic action at work by microscopically eavesdropping inside human hair follicles. If only Charles Michel had microscopic video. We at Electrolysis Research have enjoyed bringing you this presentation, and as with all our teaching videos, we welcome your comments and suggestions. Thank you.